With that, we will move on to House File 8. Representative Berg, welcome back to the committee. Would Representative Pryor like to move House File 8 before the committee?
So moved.
We have House File 8 before us, and Representative Berg, I understand you also have an A1 amendment.
Thank you, Madam Chair.
Representative Pryor, would you like to move the A1 amendment?
So moved.
Representative Pryor moves the A1 amendment. Representative Berg, would you like to speak to the A1 amendment?
Yes, thank you, Madam Chair. This amendment increases the funding to schools to approximately $250 million a year, incorporates language from school social workers asking to maintain positions that were hired with temporary CARES Act funding, or to move a partial FTE up to a full-time position, adds back the school nurse position at MDE, adds the workforce language from last year, and incorporates additional language school psychologists requested for workforce growth, makes the workforce funding ongoing, adds a requirement in the application to MDE that districts list what their current roster of FTEs in these fields are to ensure equity among positions.
Thank you, Representative Berg. That's the A1 amendment for us. Anybody have any questions on the A1 amendment? Seeing none, all those for the A1 amendment, please say aye.
Aye.
All those opposed, no. The A1 amendment is adopted. Representative Berg, continue.
Thank you, Madam Chair. I just want to note quickly that I have permission to share this story with you all today. My youngest son was a sweet, sunny, kind, and curious little towhead boy. His teachers often commented that he was so kind to the other kids in his class, always checking on a classmate who seemed to be having a hard day or seemed sad. He had an indelible smile, until he didn't. In third grade, he was diagnosed with ADD, and that is when I began to see the sparkle in his eyes grow dimmer and dimmer. I could see that he quickly learned that he struggled to do what the other students seemed to do so easily. I could see how much this daily realization affected his self-esteem, the frustration, anxiety, confusion, and shame. It was a shame that first broke my heart, and it's his anxiety that nearly breaks me still today. He was a quiet kid who didn't call attention to himself. He had a brilliant and inquisitive mind that nobody could see or foster. He just sat lost in his own head. I tried everything. I changed his diet. I researched best practices. I helped as much as I could with his studies as a working mom, and I felt powerless. We were distressed to find that there were only part-time school counselors in his elementary school, divided between several campuses and only available a couple of times a week. By the time we came up with a plan for Jake, he was off to middle school, but none of this information followed him, so we started all over again, and again without enough student support staff to help us. So he sat in his classes, went largely unnoticed, and the very best things about my son were lost on almost everyone around him. Now, dear listeners, we're off to high school, but this is where the story takes a turn. Upon his arrival in high school, we once again found that none of his information or plans followed him. However, this time we found an ally when we finally had access to a full-time on-site school counselor. We now had a partner in advocacy and someone to guide us towards building Jake's future, which I had never questioned was and still is bright. By then, he had fallen so far behind in his credits that success looked unattainable. But his school counselor, Mr. Hendricks, pointed me towards another option. And this is where Jake's life changed. I was told about the Alternative Learning Center in Burnsville, but the program was almost full. So, acknowledging my privilege as a mom who could walk into that building in the middle of the day and demand to see the dean and say that I was not leaving until I did, I was able to get Jake into the alternative learning courses, and that made a huge difference, a difference I never would have known about if it hadn't been for his school counselor. I never thought for even a moment that the teachers and support staff didn't care about my son. They were working within a broken and overburdened system that has left teachers and support personnel at wit's end. When I was at the doors this election cycle, I spoke to so many teachers and school staff that broke down in tears, not knowing how to make things better for the students they care so much about. I spoke to a school counselor in another district who had 1,000 students assigned to just her. The ratio is supposed to be 250 students per counselor, which still seems overwhelming. These are fields that we are struggling to recruit new participants into. There is little incentive to enter a job where we are at a nearly crisis level with burnout, lack of resources, and not enough support personnel to help carry the heavy load of reaching every student in need. Spoiler alert, it's every student. Our students need more supports: mental health, physical health, and social emotional supports. This bill would provide ongoing sustainable funding to every school district and charter school in Minnesota to allow schools to prioritize these supports. Districts would receive dedicated funding, at least $50,000, to hire a school nurse, school counselor, chemical dependency counselor, social worker, and/or psychologist. Minnesota has 6,000 fewer school counselors, school social workers, school nurses, and school psychologists than necessary to meet the needs of our students. We know student support personnel close opportunity gaps. School social workers provide children in need with access to transportation, academic supports, counseling, basic nutrition, and in some cases, they help students find housing. School nurses are often the only medical professionals a student will see for months. Nurses educate students on allergies, mental health, hygiene, and emotional regulation. School counselors and psychologists provide education on a social-emotional learning through a racial justice lens. In my districts, families are asking for more school counselors. Some schools might need more social workers or nurses to meet the increasingly complex medical needs of our students. This bill provides local control to hire the student support personnel most needed in their community. Madam Chair, I have several testifiers with me today.
Thank you, Representative Berg. Why don't we start out with, just lost my page here, sorry about that. Nicole Woodward, Director of Special Ed and St. Croix River Education District. Next up will be Keela Poolers, and then Emily Goodhue. Please come on up, state your name for the record, and proceed.
Good morning, Madam Chair and members of the committee. My name is Nicole Woodward, and I am a licensed school psychologist and school administrator currently serving as the Director of Special Education for the St. Croix River Education District, also known as SCRED. And I really appreciate the opportunity to be here with you this morning to testify to all of you on the significant issue of student support personnel shortages in Minnesota. The St. Croix River Education District is proud to serve 6 school districts in East Central Minnesota. SCRED is known as a progressive organization that has historically attracted a healthy amount of school psychologist candidates because of the dynamic and foundational role that they play in providing innovative services to our member districts. Having been a school psychology intern at SCRED myself, I learned early on that there are few better places to learn, serve, and grow. SCRED has long realized that school psychologists are critical players to the implementation of evidence-based frameworks like a multi-tiered system of support, or MTSS. Trained in organizational principles that align with effective schools, our school psychologists are critical players in multi-layered instruction, assessment, database decision-making, engaging families, and supporting students. Without school psychologists, we would not be able to take on a framework like MTSS, and the needs of many students would not be identified until they are already struggling significantly. Due to budget constraints, our districts have had to reduce school psychology positions or maintain insufficient staffing levels. In addition, we have seen an alarming decline in the candidate pool for school psychologists coming into the field. Currently in our system, we have 3 open positions and 1 applicant at what we consider to be the height of our hiring season. 2 of these positions have carried over from openings last year that we had to fill with telehealth school psychologists. And while those school psychologists are incredible professionals who are doing great work, not having in-person school psychologists has significantly impacted our system. One teacher stating to me that the school psychologist serves as a bridge between different aspects of the system, and without that on site, large gaps now exist for both students and teachers. This story is not unique to SCRED, and many of my colleagues across the state would echo the same sentiments with positions that have been left unfilled and needs left unmet. In one of my rural districts, we have an incredible school psychologist who serves the entire district, early childhood through age 21, with a student to staff ratio of 1 to 1,000. This is twice the ratio recommended by the National Association of School Psychologists. And she is significantly limited in her ability to support evidence-based practices that benefit all students, as she must focus almost exclusively on special education and legally mandated tasks. This staffing level ultimately impacts students, teachers, and teams across the whole system, including families and the community. If this district had additional aid, as in House File 8, to fund more student support personnel, it could open many new doors of opportunity for this district. At present, there are only 3 school psychology graduate programs in the state of Minnesota. The educators who graduate from these programs hold expertise that is extremely valuable and could benefit schools across our state. However, we are not producing nearly enough of these professionals to meaningfully address our shortages. If we truly want to meet the need of every student and family in Minnesota, we have to commit to significant support for school psychologists workforce pipeline and to address shortages not only for school psychologists, but nurses, counselors, and social workers as well. We have the opportunity to become a state where every student receives an equitable, high-quality education. But if we want to pursue that reality, we have to commit meaningfully to addressing these shortages. There's no way around the issue, and we are feeling it more and more with each passing school year. Thank you for the opportunity to share my experience in support of this crucial legislation. I urge the committee to pass House File 8.
Thank you so much. We have Keela Coolers next up, and then Emily Goodhue. Go ahead and state your name for the record and proceed.
Madam Chair, members, my name is Keela Coolers. I am the 2022 Minnesota School Counselor of the Year and Vice President of the Minnesota School Counselor Association. Today, I hope to expand your understanding of how essential elementary school counselors are in the complete equation of student mental health. To be straight to the point, only half of Minnesota's schools in 2021 had a school counselor in the building. School counselors are almost completely absent at the elementary level, and that is not because there's a lack of need. These schools are operating with an incomplete system to address student mental health. In some scenarios, it is completely reactive system. Others, they rely on classroom teachers who are not trained in mental health and already managing so much. Elementary school counselors bring unique training and services to schools that create complete equations to support student mental health from a comprehensive approach. One of the ways elementary school counselors are unique is that we proactively teach standards-based classroom lessons. At my school, we teach in the classroom for over 500 students every week. In fact, about a third of my time is spent teaching in the classroom. In these lessons, we cover a wide scope of social, emotional, and interpersonal skills. For example, we explore calming tools that help us on the bus, the lunchroom, at recess, in the classroom, during a test, or at home. And we practice so those strategies are available to us when we need them. Students that can de-escalate more quickly increase their ability to focus on instruction and are better able to engage in learning tasks and challenges. And while I genuinely love my job and working with so many young brains every day, there are many present challenges. Simply put, the current state of need is just so great. Every day, and in the continual shockwaves of the COVID pandemic, I am placed in positions to have to prioritize working on multiple situations that need vastly more time that is available in the day. And I know many of my state colleagues across all levels share in that sentiment. Our National School Counseling Association has best practice recommendations, as mentioned, as 1 to 250 students. Minnesota in 2021 was over double that, averaging 1 to every 570 students, the 4th worst in the nation, the 4th worst. Ratios matter. Ratios make a difference for the lasting mental health of our students. And just as the state of student mental health is in need of significant change, the school counseling profession in Minnesota is also needing support at the state level. To name the problem, there's currently no school counselor representation at the Minnesota Department of Education. This is to the detriment of counselors practicing the state, as well as the fine work happening within the department, as I've illustrated already how integral counselors are in school communities. I hope you see from my testimony today with the unique preventative work that school counselors bring when they are part of the school's complete equation to support student mental health, Students are empowered with tools to recognize and respond to their emotions in a healthy way, and they are better equipped with the needed mindsets and behaviors to take on learning challenges. Minnesota students deserve access to a school counselor from the start of their education. School counselors deserve to be lifted up and supported by the state as they work towards mental health for our students. I genuinely thank you for your time today, and I ask you to support House File 8.
Thank you so much for your testimony. Next up, we have Emily Goodhue and then Lila Heine. Thank you. Please state your name for the record and proceed.
All right. Good morning, Madam Chair and committee members. My name is Emily Goodhue. I am a member of the Minnesota School Social Workers Association and a school social worker in Minneapolis Public School District. Your introduction of this bill really struck my feeling of overwhelm and sadness for our students, so I'm going to try to get through this without crying. My message to this committee is that students cannot learn if their mental health and physical needs are unmet. We support HF 8 because it ensures access to vital resources that will support our students' physical and mental health. As school social workers, we dedicate ourselves to supporting healthy environments for our students. Research has proven that school social work interventions are effective in helping young people obtain the necessary skills to solve problems, improve their peer relations, and increase their academic achievement. This bill invests in school-employed support personnel like school social workers, nurses, psychologists, counselors, and chemical health counselors. While we are unique disciplines, together we form an essential team in each school, and we come to you today with one voice. This bill will provide essential resources to schools who are struggling to meet complex and increased student needs of today. And as Representative Berg noted, we are really struggling, and it is pretty heartbreaking to not be able to sufficiently support our children. School social workers across the state are providing crisis management services to students. In the 4 months since I started at my school, we have had 3 students lose immediate family members, and I have conducted suicide risk assessments for students younger than 11. We have students who come to school in tears because they don't know where their family will be living. And we have others who miss multiple days of school because their family's housing is so unstable. This is all in a school of only 225 kids. HF 8 offers 2 key components. One is an investment in school-employed student support personnel that allows funding to be used for new full-time positions, to move a part-time position to full-time, and to ensure that the positions funded by the American Rescue Plan, which are so important, are sustained after that funding stream ends. The second component addresses workforce shortages that impact all of our professions. Investing now in our children, schools, and mental health workforce is an investment in their healing, recovery, and ability to learn. And they really need it. Thank you.
Thank you so much for your testimony and for sharing your experience. Next up, we have Lila Henry, and then finally Tara Cliff. Please state your name for the record and proceed.
Thank you, Madam Chair, and all committee members for this opportunity to testify in support of House File 8. I am honored to be able to support this bill. My name is Lila Heine. I am currently a junior at Roseville Area High School, and earlier this year I was officially diagnosed with anxiety, though it was something I've struggled with for a long time. I didn't know who to talk to or what I should do to help with how I was feeling, but thankfully I was privileged enough to have access to doctors and a therapist. I know many are not as lucky as I am, though. Over the years, I have made many friends and encountered many people who have been through more than I could ever comprehend. I've witnessed the most caring people suffer through mental struggles that they couldn't or were too scared to get help with. I've had close friends tell me they wished they weren't here anymore, or that they hate themselves so much that they can't look in the mirror. I've talked to and tried to provide love and support to so many friends who are struggling with their mental health. But after seeking support for myself, I now know that nothing can ever compare to professional help. Helping students with their mental health is not the job of a teenager or even a teacher. This is the job of a trained professional who can give my friends what they really need. It's important that these resources are accessible to all, and there's such an enormous need. Something that I know my school and I take pride in is our staff. We have a team of amazing psychologists, counselors, behavioral interventionalists, teachers, and many more. But our school social workers, school psychologists, and counselors are simply understaffed, with many students having to wait for the help that they need. It's important that we provide schools with the opportunity to invest in people that support our students outside of our classes. School can take a lot out of a person, and teenage years are more complicated now than ever before. And when students' bodies and minds are healthy, we can really focus all our energy on learning and school. To be successful in school, it is not only do we need great teachers and paraprofessionals, but the student support personnel that also help us in many ways. Please take into consideration students like me when making decisions, and please provide the needed support and funding for the whole student. Thank you.
Thank you so much for your testimony and coming up here and helping ground us in the experience of our students. Next up, we have Tara Cliff. And she is remote, so please state your name for the record and proceed.
Thank you. Madam Chair and members of the committee, my name is Tara Cliff, President of the School Nurse Organization of Minnesota, or SNOM. We represent licensed school nurses, or LSNs, working in school districts across the state. SNOM thanks Representative Berg for House File 8. Our current Minnesota law, established in 1986, requires an LSN only if there are 1,000 or more students in a district. So whether a district has 1,000 or 10,000 students, they're only required to employ one LSN. In other words, if a district has 999 or fewer students, there is no requirement to employ a licensed school nurse. We must change this. All students should have access to school health services. We believe approximately 2/3 of Minnesota schools do not have an LSN in their school, and the ratio of students to LSN is approximately 1 to 1,400. But that number is not based on full-time equivalency. However, this number isn't fully known as the data is not being tracked by MDE at this point. As an example, one rural district has over 1,600 students. The LSN has over 14 schools with 10 locations across the district. Each day, she is called to these locations for immediate and necessary medical attention to students. The student health situation has become critical. Because of advances in medical treatment, children who would not have survived are now thankfully living and attending school, but often with significant health issues. Our nurses help students from preschool to high school plus with asthma, seizure disorders, severe depression and mental health issues, life-threatening allergies, tracheostomies, gastric tubes, just to name a few. Our nurses have countless stories about the student lives that they have saved because an LSN who is properly trained to be able to spot a medical or mental health emergency that an untrained person would not have been able to identify. This results in saving lives or catching the situation before it becomes a lifelong medical problem. A school nurse may be the only source of healthcare for some students. They may not have insurance or reliable transportation, or they can't afford medical care. Many health offices are staffed with secretaries and health aides who only have basic first aid and CPR training. We would love to work with any legislator who would help us improve this situation. Healthy students are better learners, and every student deserves a school nurse. Thank you.
Thank you so much for your testimony. Members, we're done with testifiers, so I wanted to open this up to questions from folks. Representative Perez-Vega.
Is it true that among thank you, Madam Chair,
Sure.
this is something that hits pretty recent, just on the amount of suicide rates that have happened in just the last 5 years of students of mine and former students that lack these services, of social work, of counselors in our schools, where we end up becoming the social workers without signing up for the job. But I wanted to get the numbers to see if it was among adolescents and young adults between the ages of 15 and 24. Is this right, that Minnesota has a higher suicide rate at 15.5 per 100,000 than the national rate of 14.5 per 100,000? And I just want to know if that's factual, that the suicide rate for Minnesota youth has been higher than the United States average.
Representative Perez Vega, I'm going to see, I don't know if Tara Cliff, that's still online, our school nurse, has any data for us. Otherwise, we'll have to get back to, Ms. Cliff, do you want to go ahead?
I don't have the specific data on suicide rates at this time. I know that speaking from the nursing perspective, the state doesn't collect any health-related data for health conditions.
Representative Perez Vega?
Thank you, Madam Chair. But you are aware that we are one of the top in the nation that deals with suicide rates of our youth.
Ms. Cole? Ms. Cliff, sorry.
Yeah, I mean, it's something that we always are struggling with our students. I don't have the data in front of me, unfortunately, but yes, it is definitely a real concern that, our counselors and social workers could speak to as well, that we are dealing with on a daily basis.
Representative Perez Vega, follow?
Thank you, Madam Chair. And it'd be great, I'm not expecting to have those numbers right now, but if we can get those for our committee, the disparities amongst our BIPOC youth throughout the state that are dealing with those mental challenges.
Representative Perez Vega, you bring up a very good point too, and I'll have our committee administrator also resend the Minnesota Student Survey from, that the results just came out December of 2022. And a lot of, some of the questions focus around where our students are feeling with their mental health needs too. So we'll make sure we send that out.
Thank you.
Representative West.
Thank you, Madam Chair, and thank you, Representative Berg, for bringing this bill. This is incredibly important, especially for my area. Blaine High School had 6 suicides in a single year. It's just insane. I mean, before that, Anoka County had like 12 suicides in the entire county over 4 years for teenagers. So this is an incredibly important issue. As for my question, I see it that both charter schools and regular schools are included in this, which I appreciate. They're included at the same value. Why there's a minimum difference? If you could explain the reasoning for that.
Thank you, Representative West. And just to remember, folks, that our traditional public schools and charter schools are all public schools. But Representative Berg.
Thank you, Madam Chair, and thank you, Representative West. I'm not sure about the answer on that. I had Mr. Strom give me some facts. Yeah, I might have to get back to you on that one. I didn't anticipate that question unless Ms. Para has an answer.
Ms. Parra.
Madam Chair, members, they both get $100 per adjusted pupil units. Are you referring to the $50,000 minimum? That's generally going to help the smaller districts that might not have that many pupil units. I'm not sure why the charters don't have that minimum.
Representative West, follow up?
Well, thank you for looking into that. It wouldn't be bad to treat them the same as the chair points out. They're both public schools, but I mean, I'm not trying to get you or anything. It's just a real question. Thanks.
Thank you. Representative Sensimura.
Yeah, thank you. Thank you, Madam Chair. Thank you, Representative Berg, for bringing this incredibly important bill. And thank you, Representative West, for sharing about your district. I did not know about that really horrific figure in Blaine, and so I'm so sorry to hear about that. And I think it just speaks to the need that we're seeing all over the state. My question was around the amendment and kind of the addition of the student support personnel workforce pipeline. I'm wondering if you can give a little bit more detail about what that grant program will look like. And I'm also wondering if we are also going to need to hear this bill then in the workforce committee. But I thank you for adding that amendment. I think in the same way that we know that our teaching force is not reflective of our students, we know that for our mental health providers. So I think that that's a really important addition. But yeah, if you can give more details, and also, do we see this bill going before the workforce committee? Thank you.
Thank you. Representative Berg.
Thank you, Madam Chair, and thank you, Representative Sensimura, for the question. In terms of whether it will go before workforce, I'm not entirely sure. I was told that it would be laid over. So we may need to determine whether that's a stop that it needs to take. And an answer for your workforce question, I'm wondering if Daniel would like to come up and speak to that.
Yes, please come up, state your name for the record. We always appreciate phone a friend. So state your name for the record and proceed.
Hi, Madam Chair, thank you so much for the opportunity to speak to the members of the committee. My name is Dan Knewitz. I am the chair of the Minnesota School Psychologists Association for the Legislative Committee. And so the question was to the grant program within the workforce. Yes, so we know, as Dr. Woodward testified to, that the workforce pipeline right now is not producing enough school psychologists to address the shortages, so it's not just a matter of open positions. And so when we look at the cost and attracting candidates and the capacity of our current training programs, of which I know she had mentioned there are 3, we need to make sure that we're taking on more students basically into those programs. And so grants that look at the cost of education, and not only just the cost of education in graduate programs, but the practical experience that they're performing in schools and also their internship, all of those things need to be taken into account as far as what would make Minnesota a place where potential school psychologists would pursue their graduate education and then enter a workforce, because I know there's also a condition that says they would then serve in Minnesota schools for at least 1 year following their graduate education. So I'm hoping that at least in part addresses your question. Any follow-up?
Representative Santamaria.
Yeah, I think my follow-up is just more of a comment. I think diversifying our workforce is a big issue in a lot of sectors, but I wonder, we've talked a lot about diversifying the teacher workforce, and I think some of the same lessons that we've learned from that work, I think could be applied here, so I think it'd be worth kind of looking into and thinking about what a grow your own program for this would look like. In the same way, we know that there's a lot of paras and ESPs in our classroom who could become teachers. I think the same thing is true for school social workers or school psychologists. I think Representative Perez-Vega was speaking this, a lot of people who are working with our youth are already kind of learning those skills hands-on or come to the work with those mental health support skills. And so I think that could be an interesting pathway to look at. Thank you.
Mr. Knewitz, did you have follow-up?
I think that is certainly worth entertaining. Thank you, Madam Chair, for the question. And I think we'll take this conversation out of committee and figure out where to go with that. But I appreciate the question and the comment. Thank you.
Thank you. Members, Representative Bakeberg.
Thank you, Madam Chair. Thank you, Representative Berg. I would echo the comments from my colleagues across the aisle about, and Representative West. This is a significant need in schools right now. And even prior to the pandemic, this was a significant need for our kids on a day-to-day basis. So I want to applaud you on the amendment. I really appreciate the workforce and the pipeline. That was one of the questions I was going to have. So thank you for that, because just when over the last few years, I've had to hire social workers, counselors, and our applicant pool is greatly diminished. So thank you for that. On the flip side of that, once you hire someone, the evaluation process to help grow and develop that person as a professional is equally as important. So Representative Berg, and I didn't see that unless I missed it in there, anything about evaluation or professional development, I would assume that would still fall under the current model that it currently is. That's not addressed in this bill at all, right?
Representative Berg.
Thank you, Madam Chair and Representative Bakeberg. My assumption is the same as yours, and if we need to find further verification, I can do that and get back to you.
Representative Bakeberg, follow-up?
That's it, thank you.
Great. Representative Knudsen.
Thank you, Madam Chair. Thank you, members, and thank you, Representative Berg, for bringing this up. In my previous life, I was a social worker. I was also an alcohol and drug counselor. Then I worked at a juvenile detention center for adolescent girls. That was 20 years ago, and things have really changed, but it was bad then. It's really bad now. And as I go out and talk to my districts and hear their top concerns, it's the mental health of our kids right now. And there's so many factors, there's so many reasons why, but it's a huge priority. So I just wanted to say thank you, and I really do support this. Thank you.
Thank you, Representative. Members, any further comments or questions? Seeing none, thank you, Representative Berg, for the bill. Sorry. Oh, last words what? Last words on the bill. Yes, last words on your bill. I'm so sorry.
Thank you, Madam Chair and members. You know, every one of us in this room gets asked the question at some point, why did you run? What possibly possessed you to run for office? And this story about my youngest son is one of the biggest reasons that I ran. And so those of you that have shared your experiences in your own communities today, thank you so much. I appreciate that.
Thank you, Representative Berg. Oh, further? Yep, go ahead.
Sorry, that was just my off the cuff. We know that children can't learn on an empty stomach, and we also know that they cannot learn while struggling with the effects of unaddressed and ongoing trauma. Our kids have always brought unseen trauma with them to their classrooms. The intersectionality of this bill and the bills we have heard the last few hearings is stark. Why are students acting out and being suspended or expelled? Why are our students missing recess, a time to get fresh air and move their bodies, as a punitive measure? What happens when our Black, Brown, and Indigenous students don't see teachers or other trusted adults that look like them at the front of the classroom? The answers are any number of complex issues that our students are dealing with every day. What we have heard today shows the ever-increasing need for what this bill will do. I know that prioritizing our students' mental health and ensuring that our student support personnel have the resources that they need is a shared value on both sides of the aisle. In ed policy the other day, Lead Bennett asked about boots on the ground in our schools, school counselors, school psychologists, school social workers, school nurses. They're right here in this bill, and I'm so grateful that she asked that question, and I look forward to her support for this bill today. I'd like to also thank everyone who worked on this bill with me. We had a little coalition with Caitlin and Daniel and other school counselors and psychologists and social workers to get this bill where we wanted it to be today. Madam Chair, members of this committee, this bill is exactly what our students need. This is what they and their families have been asking us for. For most, if not all of us, there is no resource that we won't fight for and no length we won't go to ensure our kids have everything they need to be healthy, to feel and be safe, and to thrive. This is one crucial way that we wrap our arms around all of our kids that make up the vibrant and beautiful fabric of our communities. This is the very best of who we are as parents, family members, neighbors, legislators, and humans. Thank you, Madam Chair and members.
Thank you, Representative Berg. And with that, I'll renew the motion to lay aboard House File 8 as amended for future education bill.